Hey gang, it's about 3 a.m. sharp in the morning. I'm at St. Luke's on the plaza. I was transferred here on Saturday morning with shortness of breath and pain in my leg. I knew I've had COVID for the last 3 weeks, so I've been basically in quarantine at home and basically incommunicado because I have not hardly been able to eat. I've lost 25 pounds. Lost 25 pounds in about 14 days. For those of you that are hard asses and trying to hold out for herd immunity, or whatever it is, fear against this vaccination, I'm telling you to get it. I was told down in intervention radiology, where they had to go down there under basically an x-ray machine, a fluoroscopy, and remove blood clots from my leg, and my blood clots start at the bottom of my or top of my foot and run all the way up past my groin. So some of these blood clots, if you pull it out in one piece, we're going to probably be about 2.5, almost 3 feet long. And to be quite frank with you, blood clots in your legs are very deadly. They can break off and end up in your lungs and become a pulmonary emboli or embolus. They can break off and go to your heart. They can break off and go to your brain and cause a stroke, other parts of your extremities. So I'm very fortunate to be where I'm at. Currently they have me on what's called heparin therapy, which is a blood thinning medication. Once I'm discharged from here, I'm going to have to be on a similar medication for at least 3 months, which means no ladders, no riding my bicycle, anything that can create an injury, because I'll be highly susceptible to bleeding, kind of like a hemophiliac, more or less. So a small fall could create a brain bleed. So this is nothing to jack with, and I'm telling you this as a respiratory therapist for 28 years. My plan was to ride this thing out, herd immunity. I didn't really want Cheryl to have the vaccination because she's had reactions to other flu vaccinations in the past, but I believe she got it, brought it home to me. I gave it to my grandkids, and I think I gave it to one of my neighbors. But according to the doctors I spoke down, the technicians down in ER, intervention radiology, I've had one of the worst cases they've seen with a DVT, deep vein thrombosis. Right now I've got 2 liters of oxygen on. That's to keep my oxygen level within normal limits, which right now they're got me at 98% with oxygen. Usually as a respiratory therapist, without O2, I was 97 to 98 without it. I also have what's they call COVID lung, which is also known, the x-ray or the CAT scan showed ground glass, which is just a description of the lungs. Kind of looks like a ground glass in your lungs. Actually, it's kind of a fibrotic lung, almost like cystic fibrosis. Hopefully that will go away completely on its own and won't scar my lungs. Right now I'm working on my incentive spirometer. I have taught literally thousands of patients how to use this thing, and typically my demonstration, I'm able to get this to go all the way up to the top, and I'm also able to keep this right here at best. So I would always tell my patient, this is your speedometer, this is your gas tank. We're worried more about your speed than we are how high you can get. So the trick is to go slow and get this to go high. So let me show you. Like I said, normally I could pop that up there nice and slow, way past 2,500, and I could do it right at best. And I've done that hundreds of thousands of times for patients. So let me show you what I can do now. So I can get up to about 1,500, so my lung capacity is about 50% of what normal is, and I shouldn't have to be able to cough like that. I should be able to hold my breath, because that's what makes it therapeutic, is holding my breath. So those of you hard asses that are holding out for this vaccine and have, I don't know, political conspiracy thoughts or whatever, this COVID-19 is nothing to fuck with. I've known patients that have had nothing but diarrhea, or friends of mine, nothing diarrhea and a cough. I've known patients that have nearly died, or friends, and I have had acquaintances that have died from this. So I'm not out of the woods yet. This blood thinning medication up here is going to switch over to another type that I can take at home, and it by a pill, and I'll be on that for at least 3 months, and it could be a lot longer than that. So while I'm on blood thinning, that means no riding my bicycle, unfortunately. If I took a fall, hit my head, I could have a brain bleed, and until I get my clot completely dissolved, I could still have a piece of that break off, go in my lung, have a pulmonary embolus, or break off, go in my brain, and have a stroke. In about roughly 12 to 14 days, I lost 25 pounds, so I kind of look like a prisoner of war camp guy. But I have been eating lately. But my point is as a respiratory therapist, do not jack around with this COVID-19. Yeah, a good majority of everybody's just getting some basic symptoms, cough, flu-like symptoms, diarrhea. I've had all of those. Now I've developed COVID lung, severe DVTs, and I'm not out of the woods yet by any means. I'll probably be here at St. Luke's for at least another 24, possibly 48 hours. I'm going to have to see physical therapy. I'm unable to walk. My right leg is just so full of blood clots that putting any pressure on it is unbearable. So as a friend, and for those of you that know me, those of you who don't know me so well, as a Facebook buddy or whatever, get your vaccination. Don't fuck around with it. Just get it done, because you don't want no part of this. It is basically, it can be a life or death situation. Fortunately, I'm not going to go into my story about everything, but fortunately, the second hospital I went to, which is St. Luke's, they've been taking outstanding care of me, and have basically saved my life, and there's no doubt about that. So that's all I wanted to say. It's about a little after 3. I've just got my pain medications on board because this DVT is extremely fucking painful. The worst thing I've ever had in my life. So fortunately they were able to move a good amount of that, and so like I said, I've been incommunicado for about 3 weeks, and now that I'm feeling a little bit stronger, I just wanted to kind of give out my personal service public service announcement. Get your goddamn vaccination. Quit thinking twice about it. Wear your mask, wear your gloves, distance yourself, wash your hands. This is nothing to joke with. I've given it to my grandkids. My wife gave it to me. As far as I know, I gave it to one of my neighbors. I was at a convention earlier that week, so who knows how many other people I gave it to, not knowing I was actually carrying the virus at the time. So that's it. Good luck to you guys. Good luck to me. And that's it. Out of here. And I'll touch base once I feel better, but I just weighing on my conscience that I should talk to you guys about that. So take it from, like I said, respiratory therapist of 28 years. I've never seen the likes of COVID in my entire life. I've been through the swine flu. I've been through just about everything. So get your vaccination, be healthy, be safe, and make it through this as long as you can alive. So that's it. 3:10. My drugs are kicking in because this DVT is extremely painful. I'm out of here.